Hi there, my name's Marnie. I am the student nurse that's on duty. I do a full head-to-toe assessment on you today. Is
Yes.
that okay? Perfect. So I'm just performing hand hygiene, and I would provide the patient with some privacy by shutting the curtain or closing the door. Can you tell me your first and last name and your date of birth, please?
Patty McKechnie, August 16th, 1960.
Perfect. So I would confirm that information with the patient's chart and her hospital bracelet, and also the hospital identification number she's been provided. Next, I would get the patient ready for the assessment. So I would put the bed up to my height, make sure that the patient is nice and comfortable. Also, my assessment starts from the moment I walk into the room. So I'm assessing the patient's level of consciousness, I'm assessing their mood, I'm assessing how they are kept, if they're clean, and this patient looks good. So we're going to start with a full set of vitals with your temperature. So I would ask the patient to open her mouth, and then I would stick the probe underneath her tongue in the sublingual pocket on the lateral side of her lower jaw. Normal temperature is about 37 degrees Celsius. Next, I would find her radial pulse. I want to make sure I'm also feeling for the quality of the pulse, if it's even and equal, and if it's bounding, which it is. Then I'd palpate for 30 seconds and count the number of beats. I'm not going to do that here today. Normal pulse is anywhere from 60 to 100 beats per minute, depending on the patient's level of activity. I would measure her oxygen saturation in her blood using a pulse oximeter. So I would take the patient's index finger, place it over, and normal range is about 95 to 100%. Next, we are going to take your blood pressure by doing the two-step method. Are you okay there?
Yeah.
You're comfortable? Okay, perfect. So I want to palpate for the brachial pulse over the antecubital fossa. Again, assessing quality, it's nice and strong. Then I'm going to place the cuff right above, making sure that it's an appropriate size. I'm just going to get you to hold this, please. So I'm going to palpate again, inflate the cuff until I can't feel the pulse anymore. Just relax, it'll get tight. Okay, so I stopped feeling the pulse at about 100 millimeters of mercury. So now I'm going to inflate it 30 millimeters above that and listen at the same time for my systolic and diastolic pressure. You're okay there? Okay, so the patient's blood pressure was 108 over 70, which is normal. Okay. Now, are you having any pain at all?
No.
Perfect. So if the patient was experiencing any pain, I would use the PQRST method to assess what the pain is like, whereabouts it is, how long it's been going on for, the quality of the pain. So now I'm going to move on to a neuro assessment. Again, I can see the patient is conscious, she's awake, she's responsive, she's cooperative, she knows where she is. I would ask the patient to remove her glasses for me. And now I'm just assessing what her eyes are looking like using the Perla method. I want to assess that her pupils are equal, they're round, and they're responsive to light. So just look from a distance. Perfect. I can see that they're constricting, which is great. And I would also want to make sure that they are accommodating as well. Can you grip my hands for me?
grip them?
Perfect. So I can feel that her grip is even on both sides. There's good strength. So she's good for her neuro assessment. Now I'm going to assess the apical pulse, which is located in the 5th intercostal space at the left midclavicular line. And because she is female, I just ask her to lift up her breast for me. I'd want to assess for any sign of arrhythmia, murmurs, things like that. So I'm just going to take a listen. Just relax for me. And I can hear a nice strong heartbeat, which is good. Okay, next I'm going to check your capillary refill. So I'm just going to squeeze the patient's nail bed gently for about 5 seconds. And then the color should return in less than 2 seconds, which it did. If it took longer than 2 seconds, that could indicate some dehydration. Next, I could assess the pedal pulses, so on the surface of her foot, and then also her posterior tibial pulse right across her medial malleolus. I won't do that now, but that looks good. Next, we are going to do a respiratory assessment. So I'm going to use the zigzag method to assess inspiration and expiration. I want to hear clear lung sounds across all fields of the chest. I want to listen for any gasping, wheezing, shortness of breath, stridors, crackles, things like that. Are you experiencing any shortness of breath? Any coughing?
No.
Okay. Any oxygen therapy?
No.
Okay. So I'm just going to have the patient relax for me. Take deep breaths in and out. Deep breath in and out. In, out, in, out, in, out. So I'm going to do that more than I have because it's aggravating the dog. But I would go all the way down. So I'm assessing about 10 times, finishing at her mid-axillary line in the 6th intercostal space so I can hear the lower lobes. Now I'm just going to ask the patient to turn for me to the side.
Like this?
Yeah. So I'm going to be listening using the same zigzag pattern on her back. And this is going to give me a really good assessment of what her lower lobes of her lungs are sounding like. And I'm going to be mindful of where her scapula is because I don't want to oscillate over that or I won't hear anything. So again, I'm just going to do deep breaths in and out. And are you okay? You're not lightheaded or
No.
anything? Okay, sometimes this can make patients lightheaded. Okay. Deep breath in, out, in, and out, in, out. So again, I would do that all the way down, again, kind of moving outwards as I'm going. Everything sounds good on that end. Now I'm going to ask the patient if she can lie down for me. And we're going to be doing an assessment of the abdomen. I'm going to ask the patient to, well, you don't have to lift up your shirt, but I would usually. And I would look for any distension, how the abdomen is looking. Want to also ask her about her bowel movements are like, how often she goes, if they're formed, what the color is, things like that. Are you regular? Awesome. If there's been any changes in her diet, if she's having trouble swallowing, digesting, things like that. And then I would take a listen, starting with the right lower quadrant and working my way up. The reason why I'm listening before I'm palpating is I don't want to stimulate peristalsis. And I should hear about 5 to 30 bowel sounds in each quadrant in 30 seconds. And if I don't, then I have to listen for 5 minutes. relax for me. Okay, I can hear lots of bowel sounds. Next, I would do a palpation, starting shallow. I'm going a bit deeper. Again, I'm feeling for any sort of rigidity, any distension, any lumps, bumps should feel nice and soft. Next, I would ask the patient about what her voiding is like, the color of her urine, how often she goes, if there's any pain or burning or itchiness, foul odors, yeah, things like that. So how is your voiding routine? Good? Okay. And then as I'm doing all this, I'm also being mindful of what her integument is looking like. Does the color match her ethnicity? What's the moisture level like on it? Do I see any evidence of skin breakdown? I can see that she has a burn here. Now I'm just going to get the patient to sit back up for me. And we're going to assess her musculoskeletal system. So I'm just going to ask the patient if she can flex her elbow for me, flex her wrist and fingers. I'm feeling for any signs of crepitus. Does that hurt at all? No. No? Okay. Can you put your arms over your head for me? Awesome. Can you push down on my hands? Okay. And then push back up. Perfect. So her strength is equal on both sides. Can you lift your legs up for me? Awesome. Excellent. No pain at all?
No.
Perfect. So that concludes my head to toe assessment. Do you have any questions for me?
No.
Okay, so at this point I would put the clothing back on the patient if I had undressed her, and then I would let her know when I would come back. Exiting the room, I would perform hand hygiene. Yeah. Thanks so much, Mrs. McKechnie. I'll be back in a couple of hours, okay?
Perfect.
All right, thank you.